So the way things fell, this support beam's now holding up a giant pile of rubble. We can't lift it without jeopardizing everyone down here. So it's time to discuss amputation.
No. Please listen to me. You've been down here almost 2 hours. By the time they clear away the rubble...
We're not cutting off her leg. You don't have to rush through this to make his job easier.
You kidding me?
We leave the leg pinned, we're risking crush syndrome.
What's that?
Your leg isn't getting enough circulation. The longer it's pinned, the more the muscle dies.
So what does that mean, like a limp?
Dying muscles release poisons. We free your leg, the poisons rush back into your system. It could stop your heart.
So could cheeseburgers. Just get your lazy friends to start moving that pile. She's got 2 more hours before crush syndrome could possibly set in.
We're digging up there by hand. I can't guarantee I can get 10 tons of debris pulled off in 2 hours.
Well, you need to try. It's my leg.
Look, it's not just crush syndrome you gotta worry about, okay? There's gas leaks, there's fire. We can never rule out secondary collapses, no matter how much we shore this thing up.
You think chopping off someone's limb inside a pile of dirty rocks is safe? Sepsis, fat embolism, hemorrhage?
Those risks are nothing compared to the risk of this thing coming down again.
Captain, he's a jerk. That's what the patient wants. Can we please just give it a couple more hours?
Yeah.
I gotta get to triage.
Thank you, doctor.
House. You don't need to thank me. It just makes sense.
Just promise me you won't let them cut off my leg.
I promise. Does that make you feel better?
For some reason it does.
I can't put you out. Press your respiration too much. It should take away some of the pain.
Will it be quick?
I'm gonna use the scalpel to slice through the skin, muscle, and fat. It should go pretty fast. Then I'll switch over to the electric saw when I get to the bone. It's 2 bones, about as thick as a broomstick. It takes about as long to get through. I'm gonna cut as close to the concrete as I can, save as much of your limb as possible. And the orthopedic surgeons back at the hospital will clean you up, have you fitted for a prosthetic. You'll be running circles around me in no time.
How bad will it hurt?
Like nothing you've ever felt before.
Baby, I'm so sorry.
Shut up.
You always love my legs.
I don't care about your legs. Baby, I love you. I love you.
I love you.
He's fallen into a coma. LP was clean, but...
What are his vitals?
Excuse me, officer.
I mean, officer. How long has there been a cop there?
I don't know, 10 minutes? He was being questioned when he fell into the coma.
Is anything else making him nervous or worried before his other symptoms?
He was claustrophobic right before the bleed and before the fever. We told him that he probably did fall asleep.
Is his BP spiking?
But that didn't cause his first symptom.
Yeah, it did. All the caffeine. We thought the problem was at his toilet, and by that, of course, I mean his head, which distracted us from the fact that it could have been just a clog in his sewer pipe, and by that, of course, I mean his spinal cord, and blah, 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 blah. You get the idea.
An arachnoid cyst on his lower spine. That's why we missed it. He's been sitting 10 hours a day, spiked his spinal fluid pressure.
Run a CT.
BP 72 and 42.
Hannah? Hannah?
Heart rate 148.
Right 7's bilaterally. It's not another pneumothorax. Neck vein's flat. There's no tamponade. Damn it, I waited too long. Hannah, you've got a clot in your lungs. I'm gonna fix this. IV streptokinase.
What's happening? What's going on?
Our body won't get any oxygen unless we can bust the clot. This is a blood thinner.
Is she gonna be all right?
It'll make her bleed more. We'll take care of that next. He's not busting the clot.
Maybe it's a heart.
What? It's not a clot. It's a fat embolism. And the amputation.
Okay, so what can we do? Come on. Do something. Please do something. Come on, guys, do something. Come on. Please, come on, do something. Come on, do something, do something!
You could have picked it up from your job. The real one, not the fake one. If you had been more honest about it.
How's that relevant?
If his wife knew about his job, they both might have been more alert to the early symptoms. We could have caught it earlier.
That's ridiculous.
Oh my God, sweetheart, I'm so sorry.
Whatever you're doing, it's obviously not working.
We think he has a systemic fungal infection. We're starting him on a parenteral antifungal regimen.
It can be transferred through bodily fluids, so we have to start you on the treatment as well.
Fungus. Where would
Could be from anywhere. The spores can become airborne.
But why would he be the only one? No one in our neighborhood? No one in his office building?
Sometimes it just happens that way. It's hard to explain.
No, it's not. I need to talk to my wife in private for a moment. Freezing. It's Diane coming back.
Mm-hmm.
Bedside 101. When a patient is near death, try to be nice.
She's not coming back. I'm not gonna lie to him.
Stop.
What? You heard what she said.
He's seizing. We've got to get him out of there. Both his kidneys are fried.
He's in a coma. He has maybe a few days left.
We could try and get him on the transplant list, but in his condition and without diagnosis, I don't see him getting selected.
He wouldn't survive the surgery.
Hence my previous comment.
What do you want us to do, House?
If it's a tumor, we start chemo, bombard his head with radiation.
Which will probably kill him in this state.
And without an MRI, we don't even know if he has one.
He's definitely dead if we do nothing. If I'm wrong, all we do is shave a few hours off.
We'll need his wife's consent.
Masters will get it.
Probably not a good idea.
He's right.
No, he's not. Consider this me officially booting you out of the nest.
He's in a coma. We think it's a brain tumor, and we need your permission to start treatment. Due to his current condition, the risk factor...
You mean it could kill him?
It's possible. But there is still hope.
Can he hear me? They say that people in comas can still do that.
Sometimes, but your husband's hearing is fine.
I didn't mean any of those awful things I said. I'm so sorry. I love you, Bert. I've always loved you. I also kept a secret from you. Was gonna tell you at the restaurant, but you got sick. Then I wanted to wait until you felt better. I'm pregnant, sweetheart.
I'd call you now to tell you I'm thinking of you, but it does me no good when the phone is just blocking my view. And I would sail back to you, and I would sail back to you, and I would come back and admit that it wasn't your fault, that I'm tired and unwilling to be the only one who was wrong, and I would sail back to you, and I would sail back to you.
Hey, how come no mask?
We think you have an infection.
Didn't the radiation work?
Did what it was supposed to do. You're dying.
What do you mean, like things are bad and then someday I'm gonna... How much time? How much time?
We can't know exactly.
A year? Less than a year?
Less than 24 hours.
I don't understand. Why are you saying this to me? You're trying to scare me? Why would you do that?
I'm sorry. It's true.
How bad is this cancer? Yesterday, you thought I had a chance.
You don't have cancer. You came in with an infection. We didn't catch it.
What kind of infection?
Doesn't matter. The radiation was the worst thing we could have done. We destroyed the part of your body that was fighting it off. It spread to your heart.
Then give me drugs. They have drugs for infections?
Antibiotics work with the immune system, but your immune system is non-existent because of the radiation.
If it's my heart, you can get me a new heart. People have heart transplants all the time.
It wouldn't help. Infections everywhere. There's nothing anybody can do. I'm so sorry. We've called your grandparents.
Get the hell away from me! Get out! Get out! What do you want? Want to see if I'm dying on schedule? Or do you want me to tell you it's all right? I'm okay with it.
I'd like your forgiveness, but I don't expect it.
Good. Because this isn't like you ran your cart into mine at the supermarket.
No. Your grandparents haven't arrived yet. If they don't make it on time, is there anything you'd like me to tell them?
Never really knew them.
You got any friends you want me to call?
It's the middle of the night. They're not the kind of friends you ask to help you move, never mind watch you die. I never did much. No kid to leave behind. When I go, the world's not gonna be any different. Kind of a relief for you, huh?
You were right about me.
Yeah, which time?
I had a problem with you. But you were wrong, too. I've made some bad decisions. Stole cars, robbed houses.
Killed a woman.
But then I got another chance. Left home, went to college, into the whole other world. There's some part of me I can't get rid of. Always thinks, if I'm not the smartest, if I'm not the first, everywhere I go, they'll figure out I'm not supposed to be here. They'll send me back.
You know that's not gonna happen. You're out.
I'll never be out of there. When I came home, that last Christmas I was in college, it was like the rooms felt so small. It was suffocating. But when I was standing on the stoop saying goodbye, my mom put her arms around me. That was the last time I ever felt at home. I only put distance between you and me because I know there isn't any.
You were right about me, too. That stuff about the system being against people like me, I know it's crap. I mean, it's true, but it's also crap. I just wasn't ready to try again. But I always thought I was young. I had time. Aren't you ever gonna leave?
His stomach's getting a lot worse. It's rigid. He's bleeding into his abdomen.
What's going on?
We need a surgeon in the OR. Stat.
On it.
Try to hang in there, Carnell. The infection caused a perforation in his sigmoid colon. It's repairable.
But it means the antibiotics aren't working.
Double the dose and add Tigersil to the list.
As soon as he's out of surgery.
Where's Richie Rich?
He said he can't leave work.
Yeah, you told me that 2 hours ago.
I'm not gonna lie.
Why, because it's wrong? Or because you're a coward?
Tough choice.
You'd be wasting 2 hours of the kid's time. Is that deeply and unforgivably morally wrong? No, because it's not a waste of his time. Unless we're wrong. Unless his condition's got nothing to do with his friends. You're just afraid of being wrong.
Your parents called. Had to catch an earlier.
You don't have to lie to him. Kid's on his way here.
He got off work?
Yeah, by vomiting blood. Ambulance is 10 minutes out.
You Teddy?
What?
Love the name. If I ever have a dog. Take off his pants.
Hey.
Don't talk to her, listen to me.
He's vomited in excess of 3 units of blood. He needs to be admitted before
If you wanted to be a doctor, maybe you should have buckled down a little more in high school.
Bite me.
What are you doing?
Exactly how close were you and Carnell?
Not so close.
Spent a lot of time together in Jamaica? Share a room?
Wait, you don't think. Look, we're not gay.
I'm not saying you're gay. I'm saying you had sex.
Look, we're not gay. We hardly even hung out.
Right. So you just flew him down to Jamaica because he won a contest.
No, he's in my frat. All right, between school and wrestling and going home every break to work at his father's junkyard, Connell didn't have any time to hang out with anybody.
It's not fungus.
I already told you that.
There's no pustules. It's not staph. His dad's what?
His dad owns a scrap metal salvage yard. Connell worked there during breaks.
You lied.
What are you talking about?
Oh, yeah, of course. In this family, probably need more specifics. You told us you owned a construction company, not a salvage yard.
I know the way things work. The better my job, the better my son gets treated.
Right. That's why I'm mad. You wasted all that filet mignon on you. Did your kid find anything unusual the last time he worked for you?
No.
Braided wire, metal weights on each end, a lead canister, maybe just the lid. Probably used it as a doorstop or paperweight.
Why would he want to?
Okay, here it comes.
I gave him an early graduation gift, the old plum I found. Looks like a fishing weight. Put it on a keychain so he always remember where he came from.
So we can lie about it later. Where's the keychain?
I don't know. He never used it, just kept it as a good luck charm.
Kept it where?
I don't know. Why? Why does it matter?
Where are the kids' clothes?
In the bureau, back in his regular room?
You two get it to radiology. It's closed. The bureau, don't open it. You come with me. Let's set it down there. Now get out of here. This thing is radioactive.
The chances of radiation causing CNS symptoms? Whoa.
Call the boys in the lead pajamas.
The radiation measurements weren't high enough to cause central nervous system damage.
It might have caused nerve damage, but it definitely destroyed his immune system.
And caused tumors.
We don't know that. None of the MRIs showed anything.
Do a PET scan. Check his cervical spine. It's not gonna be good news.
Mr. Hall, it's not good news. The piece of metal you gave Carnell was from an industrial device used to test wells. People aren't supposed to just dump radioactive material.
But they do. So what now? I mean, what do you do?
Anyone who's had contact with the source will have to immediately get treatment for radiation sickness. Taddy carried it on the slab on the flight.
So there is a treatment.
Transfusions. And we try to get the fluids and electrolytes balanced. Carnell, he's had much more exposure. The equivalent of about 70,000 chest x-rays. His ability to create white blood cells has been completely destroyed.
That's why he can't fight off this infection.
Yeah. He's gonna need a bone marrow transplant.
Thank you. Ooh. Ooh. So how much longer do you think he'll be in surgery?
It's hard to say.
You know, he just started school when Ann died. I was a mess. Still adjusting to being a parent, much less a single parent. You know, I used to put cold pancakes in his lunchbox. I mean, that was the only thing I could make that he would eat.
You did okay. He's a good kid.
Oh, hey. So how is he?
Well, the surgeon has removed the tumor without damaging the spinal cord. But the infection has caused another intestinal perforation. We stopped the bleeding, but his white count keeps falling.
Okay. So what now? Another drug, antibiotics, what?
I'm sorry. The reality is, no matter what we give him, it's unlikely he's going to be able to fight off the infections.
Okay. Hey. How you doing?
I'm hanging in there.
I'm sorry I lied to you about Mom.
I'm sorry I lied to you, too.
There was nothing good that came out of her dying.
I'm not mad. I know why you did it. It worked. I never drink and drive. I'm scared, Dad.
There's nothing to be scared of. You're gonna be just fine.
Don't play me. I want to know the truth.
I'm telling you the truth. You're gonna be fine. I swear.
I love you, Dad.
I love you too.